Often patients come to our office with a very long history of typical reflux symptoms, and often they've been taking medication for a very long time. Sometimes they've had a lot of testing done, but they're surprised, most of them are surprised to find out that no one has actually proven that they have reflux. This is classically done with pH monitoring. There are a couple of different ways to do acid monitoring or pH monitoring. The what we term older way of doing it is with the patient seated in a chair, numbing medication is placed in the nose, and a catheter is a very small catheter is passed through the nose into the back of the throat. The catheter is then secured with a little tape to the face, and the patient wears that catheter home for about 24 hours. There are sensor probes for pH on the inside of that catheter, so when patients regurgitate, the probe senses that acid reflux is happening. The newer way of doing pH monitoring, and the way that we most commonly use, involves placing a capsule in the esophagus to measure pH. This is a wireless device that is about the size of a large multivitamin, and it can be placed at the time of endoscopy while the patient's sedated, or it can be placed while the patient's awake with just some numbing spray in the back of the throat. The capsule is attached to the end of a catheter. It is swallowed. The capsule attaches at a certain level in the esophagus and clips on very, very superficially. The catheter comes back out. And with either of these methods to monitor pH, whether it be the 24-hour monitoring with the catheter or the 48-hour monitoring with the capsule device, patients wear home a small computer as a necklace, basically, and the capsule or the catheter transmits information to that computer. The patients then bring that computer back to us. The information is downloaded, and we see a very beautiful readout of what their reflux looks like over the period of time that we monitored them. We see how many episodes of reflux they're having, how long those episodes last, and really essentially get a great picture of how severe their reflux is. It's really important first to answer whether or not the patient has reflux. Not terribly often, but not uncommonly, we'll see patients in the office who have been told they have reflux for years, and we do the testing and they actually don't. So then you kind of take a few steps back and start thinking about what other options there are to be causing the symptoms that they're having if they don't indeed have reflux. We use this data to offer treatment options and make decisions about surgery, and sometimes insurance companies really want to see proof that patients have documented objective reflux before approving surgery.